Good afternoon, everyone, and thank you very much for being here on this webinar. I sincerely appreciate and express my gratitude to the Ambassador of India for organizing this webinar on COVID. As you can see on the slide, the topic that I'm going to talk about today in a language that I think hopefully would be easy for you to understand. And I hope at the end of this talk, you would have more clarity on it and that many of your points of concern will be clear. So I'd be talking about how to deal with COVID-19, what are the facts and the myths. COVID-19 is an infectious disease that is caused by a most recently discovered virus, the coronavirus, which was from an outbreak that began in Wuhan in China in December 2019. It's a contagious disease, and though zoonotic means originating in animals, it is contagious in humans, and the World Health Organization has designated it as an ongoing pandemic. This SARS acute respiratory syndrome, coronavirus 2 or SARS-CoV-2, is the particular virus strain that causes this COVID-19. Right? You can see that this may look very scientific and complicated to you. But let me explain this to you in a language that's easy to understand. What does the virus do? What are the properties in the virus that affect the human body? Now they have multiple proteins. So the S protein or the spike protein is the protein on the virus that attaches itself to the cell in the human body called the host cell. And what it does is it starts causing degeneration of the infected cell. At the second stage is the E protein or the envelope protein or the envelope small membrane protein, which then actually causes cell stress. And this leads to what we say as apoptosis or the beginning towards cell death. So the virus infects the cell and causes cell death. Then there is the M protein or the membrane protein. And this particular protein, what it does, it starts inhibiting a protein or a cytokine called interferon gamma that actually is essential to throw away or fight against the virus and remove the virus. But this protein starts inhibiting it. Then the N protein then comes into the picture, the nucleoprotein, and it starts inhibiting the interferon gamma to a greater extent and causes cell death. Subsequently, there are, of course, the HE, beta-CoV protein, and NS protein, and all this start then working towards causing a viral replication or increase in number of the viruses, and the cell has gone into cell death. What I will try to show you is the global scenario. Now, this is as of April 27th, and you can see here on the right-hand side, the number of confirmed cases are over 3 million, number of recovered 900,000 plus, and number of deaths globally about 200,000 plus. And you can see the country-wise distribution, and the largest burden being in the United States. It started in China, but it spread a lot towards Europe and the United States. And still many of the countries in the Southeast Asian region are markedly affected by this COVID. If you look at the upper left, it's the situation or the cases on 14th March. And the lower right is the situation on 14th of April. So as you can see here, that on 14th March, we had these number of cases in Tokyo, for example, and the maximum cases were mainly in Hokkaido. But as you see in 14th April, there's a marked increase in the number of cases in Tokyo and in other places. So the peaking towards a much larger number. Slide. Let's come into the more details of the cases in Japan. So if you look at this table, they are PCR tested and PCR positive. And these are this is a situation, the total 13,232 cases confirmed. They've broken this down, and this is from the Ministry of Health's data, and shows that the number that are domestic cases, airport quarantines, returnees by chartered flights, and the total number. And those that were PCR tested and how many of them were actually PCR positive. And then it also shows the breakdown on those who had symptoms and those who had no symptoms. And then the total number are over 13,000, recovered almost 3,000, and deaths about almost 400. It shows that within this number of cases that actually were positive, how many had mild to moderate symptoms, how many had more severe symptoms, which even required the use of a ventilator or intensive care unit. So you can see that the majority of them were, of course, mild to moderate, and there was a certain proportion of them that required ventilator and intensive care unit. And then you can see it's also broken down into the 4 parts. Those are domestic, those are airport quarantine, those are returnees, and the total number. I'd like to actually talk to you about what it does to the human body. So what does the SARS-CoV-2, or what happens in COVID-19? What are the symptoms that occur? Now, it's mainly a respiratory disorder, but it has many other systemic involvement. That means it affects different organs of the body. So we have systemic and respiratory disorders. So the systemic, for example, you can come with fever and cough, general fatigue, sputum, headache, blood in sputum, cardiac injury, oxygen levels are low, breathlessness, the number of lymphocytes go down. You may manifest with diarrhea. You may manifest with upper respiratory symptoms like rhinorrhea, sneezing, and sore throat. And then you can have the more severe part is the pneumonia and ground glass opacities, and the most severe is acute respiratory distress syndrome. So in short, when you talk about the symptoms, the main symptoms are like fever, fatigue, and dry cough, but these multiple manifestations can occur, and there are a variety of ways of which it is presented. Sometimes patients do have cough and fatigue, but not really very high temperatures. Now, who is more susceptible? Generally, it's the older people and the people with pre-existing comorbidities like diabetes or hypertension. But it affects people of all ages. So people of all ages can be infected by COVID or the coronavirus. Now, so if you look at the risk factors for COVID and the lower part, I'd like you to focus on the lower part. So you can see very clearly that there is comorbidities, there is age, and some inflammatory parameters like a high C-reactive protein, high levels of interleukin-6, and a high level of ESR. So these actually serve as risk factors for more severe disease in COVID. So what it does in the human body is the virus actually enters the respiratory system. Now, basically, the virus is so tiny. It's really, really minute in size, in nanometers in size. And this virus particle enters the upper airways, can pass through the upper airways to the lower airways, attaches itself to cells that have the angiotensin C, angiotensin receptor 2. And as you can see here, the alveolar epithelium has angiotensin ACE2 receptor. So it attaches itself to this receptor, and then it starts the process, as I mentioned before, of downregulating interferon gamma, causing cell apoptosis, and actually causing viral replication. And when this viral replication and hyperinflammation occurs, there is an influxion of a variety of inflammatory cells like monocytes and macrophages and neutrophils that come from the peripheral blood into the tissue and release a variety of cytokines which is what we call as a cytokine storm. So the virus actually dampens the antiviral responses by downregulating or reducing or suppressing the function of interferon gamma. I'd like to actually go across the same thing in short way, that the viral infection leads to a non-specific innate response where the immune cells slowly progress of the virus and start causing the symptoms. Then you have the adaptive response where the body then starts building antibodies to the virus. And when the antibodies are come into the system, the body starts developing a kind of immunity against the virus. Now, when you develop this immunity, the important thing is how long will this immunity last? How many days would this antibody stay in your system? Can the person get reinfected in the future? These are open-ended questions because this virus is different from every other virus that we've known. And it's different also in the way of transmission. So all of us are still trying to understand these open-ended questions. When you talk about the recovery time for a milder case is usually about two weeks, but for more severe cases, it's approximately 3 to 6 weeks. Now, unlike many viral diseases that are transmitted through mosquitoes or transmitted through animals or by eating certain animals that are infected, this is different. This is human-to-human transmission. So the main transmission occurs through droplets that are generated when an infected person coughs, sneezes, or speaks. And these droplets are, as you can see in this picture here, they are spread out into the air, but they are heavy and they don't hang in the air for too long. They hang in the air for some time, but then they fall onto floors and surfaces, and there they can remain in that state. And breathing in that virus, either directly if you're in close contact with the person who's infected, or by touching contaminated surfaces where this virus has settled, and then touching mucosal surfaces like your eyes, nose, or mouth before washing your hands could lead to transmission of this infection. Of course, if you just touch your skin, it doesn't get transmitted through your skin. It gets transmitted through mucosal surfaces like the eyes, nose, and mouth. Again, highlighting the way it is spread through droplets, through touching surface objects. And let's see what happens. For you see on the picture on the top, you can see how the droplet infection occurs. Then you can see the cluster phenomenon. You can see when people are together in a congested area or crowds, that's another important way of the way this virus can spread the infection. And the other thing is, as you can see, touching surfaces that have got the virus droplets settled on the surfaces. These, again, can cause the spread when you actually inhale it or when you touch the surface and touch mucosal surface. Can pre-symptomatic transmission occur with a coronavirus? Yes. Symptoms usually appear after an incubation period. After being infected, this can range from 5 to 6 days to even 14 days to weeks. During this period, the person can be infected. So this person can be a source of infection to someone else, even before the person actually manifests the symptoms. Now, this is what happened in Japan as of March 9. You can see in the different cities, Niigata and Osaka, and Arida, Aichi, Ichikawa, Tokyo, Sagamihara, Kitami, that there were all these different clusters that occurred either due to gyms or in live houses or in hospitals, welfare centers, elderly care centers. So all these different places which had people, exhibitions, so where people came together, and one or two people who had the infection were causing this cluster phenomenon and spread of infection. How long can the virus stay on the surfaces? Because we were talking about the viruses settling down on the surfaces. So, well, that ranges from few hours to several days. Now, few hours, like if in the air, approximately 3 hours, it can remain in the air as airborne droplets, on surfaces, depending on their hard surfaces, generally up to 72 hours, and then more porous surfaces, usually up to 24 hours. But this is not very hard and fast. There can be some variation in this, but approximately. Now, if you think a surface is infected, what would you do? You would ensure that surfaces, all these surfaces are clean. So it's very important to clean the different surfaces that you're in touch with, clean the equipment that you use. And how would you clean? You would clean it with 70% of ethyl alcohol to disinfect, or you could use sodium hypochlorite at 0.5% and for disinfecting the surfaces or the equipment that you use. Hand hygiene is very important. And I'll also demonstrate through figurative representation how cleaning of hands has to be done. So frequent cleaning of hands and cleaning with alcohol-based hand rub, covering the nose and mouth with a flexed elbow while sneezing or coughing, or using a disposable tissue, and avoiding close contact with anyone who has a fever and cough, even if the person is not proven to be COVID positive. And we know there are many young couples here and anxious and worried. They're happy to have a new baby. They're happy that they're going to, it's a happy moment for them, but the COVID has raised concern. The important thing that needs to be known is that if you take care, you can try to protect yourself from getting infected. But pregnant women are at equal risk as others and should protect themselves from COVID. There are some reports that say that in general, estrogens, that is female hormones, can have some protective effect against viruses. But again, this is not proven for SARS-CoV-2. So I would like you to think that they are equally at risk as every other person. And then, of course, when you look at the people who are infected, the pregnant women who are infected can have more severe disease. So the important thing here is that they should avoid the sick people. They should avoid people who are exposed to the virus. They should maintain good hand hygiene, like cleaning with soap and water rigorously, and sanitizers, and clean and disinfect the surfaces that they tend to touch daily. What about breastfeeding? Now, a baby is born and mother's excited, and the best contact, the closest contact of mother to child is breastfeeding. That is a very important aspect of in infancy and also for the mother. Of course, you can breastfeed because it's also an important source of and the best source of nutrition. The World Health Organization recommends that. But if you're sick, what do you need to do? You need to wear a mask. So if a pregnant woman, if a breastfeeding mother is sick, she needs to wear a mask and wash her hands rigorously before each feed and sanitize it also. The other way, of course, is to express the breast milk into a bottle with a breast pump. But in that case also, the hand hygiene should be maintained, and all the equipment, including the breast pump, the bottle, everything should be cleaned and completely sanitized so that there is no source of infection to the child. Now, babies don't get this transmission in pregnancy. So mother to child transmission in pregnancy doesn't occur. It's not known. There are a few newborns in which we have seen COVID positive newborns. So the virus can infect newborns, but that is not something that has happened during the pregnancy. That has happened after birth. And that's why it's very important to keep that hand hygiene, to keep the child away from those who are sick, and to disinfect all the surfaces the child is likely to be touching or close or being in contact with, and that all the child's clothes should be laundered very well and cleaned with sanitizer, so that the child is avoiding any form of any source of getting infected from the virus. Well, in the beginning, many countries would say only an infected person should wear a mask, whereas in Japan, we've always said every person should wear a mask. And there is a logic behind it. Because when you're wearing a mask and you're asymptomatic, you're also protecting somebody else from being infected. When you're wearing a mask and you're not symptomatic or you don't have COVID, You're protecting yourself from being infected from infectious droplets from an infected person. So both ways, it's very important for a healthy person and a sick person to wear a mask. So wearing mask is very important. When you wear a mask and you remove it, make sure you do not touch the surface of the outer surface of the mask. You try to remove it by removing from touching the inner surface. And you put it in a plastic bag and dispose it off. You don't throw it off like that into the waste material. The hand hygiene is also, as I said again, with cleaning with water and soap and with alcohol. But as you can see in this figure, you have to do it between your fingers. You have to do on both surfaces of your arms. You have to scrub between actually your on the palm of your hand. And then you go twisting in many ways with the soap and water. And then you also use a sanitizer. So this is very important. It takes about 20 seconds, but try to do hand washing as often as you can. This is very, very crucial. Social distancing is very crucial. So you keep a distance of about 1 meter between the people that you're surrounded with. We don't know who is infected sometimes, and so keep that distance. And this is very important to prevent yourself from being infected. The surfaces that you may think may be infected. If you touch the surfaces, do not touch your eyes, nose, and mouth. And keep good respiratory hygiene, like wearing a mask. And also, if you're coughing, cough onto your upper arm and not into the atmosphere. The other thing is that rinse your mouth, gargle when you come back home, and maintain a very good oral hygiene. This is crucial also for preventing yourself from getting infected. So if you're a person who is sick, what would you do? If you're ill with fever and cough, you clean your hands with alcohol and with soap and water. You stay in a room that is separate from others so that you're preventing others from being infected. The room should be well ventilated. And generally, whoever visits you, the family members, should try to keep a distance about 1 meter away from you. And make sure you wear a mask. Avoid going out and make sure you stay at home. Stay home. And if you cough, try to cough onto your elbow or your upper arm and avoid the droplets from being spread into the atmosphere. So if you're a member of the household, you also maintain hand hygiene. You also maintain the same respiratory hygiene. And when you take things for the sick person to that person's room, you avoid direct contact, and all the utensils that the person uses for the meals should be kept separate and not to be commonly used by other members of the household. Now, this can cause a sense of stigma, and that's the thing. Never make a stigma of this. This is like any viral infection, like influenza and everything. It may be more contagious, more virulent, but it's not something that you should stigmatize somebody about because they get COVID. All members of the house should monitor for fever or any symptoms, and if something arises, they should immediately take notice of it and then take the next steps, as I will come towards the testing part of it. For caregivers, because the caregivers are actually the people who are most susceptible to it because you're taking care of the sick person. So you follow similar kind of hand hygiene, respiratory hygiene, keep the distance, wash all the utensils very carefully. You could use gloves while washing those utensils, and all the materials that's used by, like the clothes and everything, should be washed separately and sanitized separately so that there is no contamination. Also, the doorknobs and everything should be wiped very carefully with sanitizer to avoid contamination to other people. So if you have, for example, fever and some respiratory symptoms, as I mentioned before, cough or upper respiratory sore throat, and generally fever above 37.5 degrees, or if you're in close contact with somebody who has it, or if you've been in an area where somebody has it, or you're coming back from a country where there is, then you would call the hotline, and this is the number of the hotline that you can see here. You call the hotline and you ask for a PCR testing. Now, generally, that PCR testing is done. Some criteria are there, like if this fever is there about 37.5 degrees for 4 days, and if you have these respiratory symptoms or fatigue, they would do the testing. But if you're an elderly person and if you're a pregnant woman, even if this is there for 2 days, they would enroll you for a PCR test. And this hotline will take you to this health center, which actually then takes you to the next step for the PCR testing, and your PCR testing would be done. And then on the other hand, if you are just concerned about it, but you don't have any symptoms, and you're just anxious about it, you want more information, you can call this other number on the right side of this slide, which will give you information in the different languages about your concerns and your, but mind it that most of these places will be really very busy because they have so many people calling in. So you will have to exert some patience when trying to contact them, but do reach out to these are the centers actually deputed by the Ministry of Health and Labor of Japan. So supposing the PCR test, which generally takes about 48 hours for the result to come through, if it is not detected, then you will basically have to go home and just monitor yourself for the next 2 weeks, because sometimes in the first few days, the PCR test may be negative and then it becomes positive. So you please monitor yourself, especially if you have the fever and some symptoms. If the PCR test is positive, then of course you need to be hospitalized, and the health center will then work towards the next steps to help getting you hospitalized. Or if it's very mild, you might be in one of those isolation centers, like in hotels, where you will be kept under observation and isolated from other people to prevent infection, and also taken care of by doctors and nurses. The summary of what the health ministry has said, which I've already covered in my talk, the infected member should avoid going to living room or other rooms if they are at home. Limit the number of persons taking care of an infected person. Wear a facial mask. There should be good ventilation in the room. Disinfect the surfaces. Wash dirty linen. Dispose materials in plastic bags, and wash your hands. These are very important points that need to be taken care of. Say the 3 C's to avoid are closed spaces, crowded places, and close contact settings. This is crucial, especially closed spaces with poor ventilation, crowded places with many people nearby, and close contact settings like close range conversation. So avoid these 3, because the risk of this will result in clusters, and this could result in a massive spread of the disease, like it has happened in many countries, like or cities like in New York, and countries like in Italy and Spain. Now, this is as crucial as all your other aspects of preparedness, because your immune system needs to deal with this virus, which is very virulent. You need to have a very robust immune system. So for having a robust immune system, make sure your nutrition is good, have healthy foods, have supplements like vitamin D, vitamin C, and zinc. These are very important because they have antiviral properties and can actually boost your immune system. Exercise. The type of exercise you do is entirely up to you, but make sure whether it's jogging outside or whether it's like taking a walk, or it's doing aerobics or yoga or some kind of training programs that you can follow on videos, but definitely exercise, because exercise again boosts the immune system. Sleep is very important, because lack of sleep can actually suppress the immune system and make you more susceptible to this virus. Stress is another important thing. We're all stressed because there are many things, even as physicians and clinicians, we are also still trying to understand the ramifications of what this disease, what this virus can do, and how and when we can control it, about the treatments, about the vaccine. And everybody is actually stressed because of it. And also stressed because of all the lockdown and all the limitations to our daily life. The new life that we have now, so different from the life we've been used to. So how do you remove the stress? Through yoga, through mindfulness. You have different ways to choose what is best for you, but try to reduce your stress levels, because that is crucial for also boosting the immune system. Does the COVID or coronavirus affect only the older people, or are younger people also susceptible? As I mentioned earlier, it affects all age groups. The elderly and the people who have comorbidities like hypertension, cardiac disease, liver disease, kidney disease, or diabetes are more prone to developing it. But it affects all ages of people. So it cuts across all age groups, younger or older. Some people say that if you hold your breath for 10 seconds without coughing, that means you're free from this coronavirus or COVID-19. That's not true. There is no such evidence to show that holding your breath can prevent you or indicates that you don't have COVID. Also, the fact that if you are like people who are recover from this disease, do they eliminate the virus from their bodies? Would they ever get reinfected? This again is an open-ended question. Generally, once you're treated and you recover, the virus is not present in your system and you have antibodies that actually protect you. But there are still, again, open-ended questions. So there are certain aspects of it that we don't know, but generally when you recover, you're free from the virus. Whether you get a permanent immunity or not, that's an open-ended question. Staying in the hot sun or in a humid climate or cold weather and snow, there are myths saying that actually protects you or that actually can prevent you from getting the COVID. That's not true, because we know that COVID is there in Philippines, in Thailand, Singapore, in many of the Middle East countries where the weather is so hot and humid. We know that. We also know that it's there in colder countries. And so neither the cold weather nor the hot and humid weather can protect someone from COVID-19. Can it be transmitted through mosquito bites? And I explained this to you earlier, like dengue and some other viral diseases are spread by mosquitoes, but this is not by mosquitoes. The origin of SARS-CoV-2 virus or COVID-19 is from an animal, but it's a human-to-human transmission, as I've been telling you several times throughout my talk, that it happens between human to human. So mosquito bites have nothing to do with COVID-19. Slide, there are some other myths again that I'd like to. Hot water bath or hand dryers, are these effective in killing the virus? No, they don't kill the virus. Again, those are big myths. So if you get these kind of information, just ignore it. They have no evidence to show that, there is no evidence to show that a hot bath or a hand dryer can actually, or hair dryer or hand dryer can actually kill the virus. Can ultraviolet light disinfect the COVID? No, and don't try doing that because you just land up with irritating your skin. Can spraying alcohol or chlorine over your body kill the virus? No, and don't try doing it because again, you'll only damage your own skin and your mucosa, like your eyes and your mouth and so on. So these are all myths. There is no evidence at all in it. There are a few more myths that I've summarized together. Can regularly rinsing your nose, a lot of people use saline washes for removing allergens in allergy season, pollen season, but this doesn't do anything for the coronavirus. It doesn't do anything for COVID. So doing this kind of rinses, saline rinses, is not good. Frequent consumption of alcohol can only risk basic health problems, but does not prevent COVID-19. What about the mobile? This is a big myth. It keeps coming. The radio waves from the mobile cannot cause any spread of COVID-19. That's a complete myth. What about garlic? Well, garlic, like turmeric and other food items or broccoli, things that have antioxidants, things that have zinc, things that have vitamin D, they all have health benefits. And they may have some antimicrobial properties also. But it does not prevent COVID-19 and does not help in treating COVID-19. What about antibiotics? Antibiotics are widely prescribed every time somebody has a fever and cough, often done, but antibiotics are for bacterial infection. They cannot do anything against a virus, so they are not used for treating virus. What about any specific medicines to prevent? At the moment, we don't even have medicines for cure. There's one drug that is likely to get approved, is under clinical trials. And there are many drugs that are under clinical trials, even in Japan. And there are many countries that are now trying different vaccines are being developed. So the drugs to treat and the vaccines to prevent are still under various stages of development. There is nothing now that can prevent COVID-19. You may think that vaccines against pneumonia or H. influenzae type B may be useful. No, they do not have, but they are specific for those influenzas. They do not have any effect on this new coronavirus SARS-CoV-2. So do not try to do this for the sake of SARS-CoV-2. That SARS-CoV-2, which causes COVID-19, is a very new and virulent virus that majority of people have mild symptoms, but in the more severe cases leads to death in the infected people. It causes massive damage to the lungs, but also causes damage to the other organs in the body. So it really can affect multi-systems of the body. RT-PCR and CT scans are significant for the diagnosis of SARS-CoV-2. And antibodies like IgG, those antibodies testing is usually done more for looking at the development of immunity. And the drugs and vaccines against SARS-CoV-2 are under different stages of development globally. Everybody is trying to fast track it because over 210 countries have been burdened with this disease, and the number of deaths and the number of people affected is just unimaginable. After the 1918 Spanish flu, this is probably the biggest pandemic in the history. So it's something that everybody has been concerned about, but I hope I have been able to give you a better understanding of what the disease is and give you a better understanding on what should be done, the logistics of what is to be done in case you have fever and so on, and of course, to allay all your fears by removing all the myths. That these are the resources that you can go to. If any of these resources from the World Health Organization, from the CDC of the United States, and from the Japanese Ministry of Health and Labor and Family Welfare will give you authentic information. Do not look at multiple things that you find in the media, social media, because there is so much that is there which has absolutely no evidence at all. And with this, I'd like to thank you for your kind attention, and I'm happy to take the questions and looking forward to interacting with you. Thank you very much.